So this is a super interesting one. Which exercises should we be using for osteoarthritis of the knee? And crucially, how often should we be doing them? Let's find out. Hey guys, Khalid here. Welcome back to Clinical Physio. So I was really intrigued by this research from Husted et al. 2021, where they looked at different exercise options for osteoarthritis of the knee. Some great detail in here, and stick around to the end to find out exactly which kind of exercises I give my patients with this condition. Now, a really interesting thing that Husted et al. Focused on was quite simply, how often should we be doing strengthening exercises for these patients? So if you've got a home exercise program, should you do it twice a week, 4 times a week, or even every day? So they took 140 patients who had knee OA and were eligible for knee replacement surgery. They gave them a home exercise program to do for 12 weeks, but they randomized each person into one of 3 groups. Group 1 did their exercises twice a week. Group 2 did their exercises 4 times a week, and Group 3 did their exercises 6 times a week. So in this situation, you'd expect that the 6 times a week group would have more strength gains than the twice a week group, right? Well, interestingly, they found that after 12 weeks, there was no statistically significant differences in the isometric quad strength, regardless of how many times a week you did your exercises. But they did find that one group had significant improvements in their pain levels and the function scores on their questionnaires more than the other groups. And that was the twice a week group. I found this super interesting. You do your exercises less, but you end up with less pain and better function. How's that possible? Here's why I think that is. So we know that there's a huge inflammatory component to osteoarthritis. We know that an arthritic knee can get really easily stirred up if we do too much activity, too much walking, or seemingly too much exercise. Therefore, rather than doing lots and lots and lots of exercise during the week, it seems like doing some exercise but allowing plenty of time for rest and recovery is the best way to do it after all. So the next question, what exercises should we be giving for our patients with knee OA? Here are some examples of the ones I find myself giving out in practice all the time. First, a static quad or a knee extension into a small rolled up towel. Particularly if straightening the knee is quite sore, doing so into a rolled up towel can make things easier. Hold for 5 seconds each, 8 to 10 reps with 2 sets. Number 2, a straight leg raise. Squeeze the thigh muscles, keep the knee straight, and lift it off the floor. Lift for 3 seconds, hold for 3 seconds, down for 3 seconds if you can. 8 to 10 reps, 2 sets. And number 3, leg extensions. Simply sitting in a chair with a bent knee, squeeze your thigh muscles and straighten that leg up. You can use a TheraBand if you want to make it more challenging. 8 to 10 reps, 2 sets. And how often should we be doing them? Well, seemingly twice a week. And of course, always consult your local physiotherapist or your doctor if you want to start doing these exercises. So if you've enjoyed this video, please support us by smashing that like button, subscribe to our channel for all our updates, check us out on social media at Clinical Physio on Instagram, and check out our website, clinicalphysio.com, loads of brilliant resources for growing physiotherapists. I'm Khalid. Thanks so much for watching. See you soon here on Clinical Physio.